What's up, guys? Dr. Chris Bark here. I got a little time for church. Thought I'd shoot a quick video, talk about maybe when to use other medications to help with withdrawal, specifically if you're stopping buprenorphine, Suboxone, Subutex, etc. Now, where I think a lot of people sometimes go wrong is they'll stop their medication at too high of a dose. So they'll stop buprenorphine at 8 milligrams a day or 4 milligrams a day, and then they'll have withdrawal. Then they'll go back on it, maybe even at a higher dose, or they'll go back to other drugs and they'll say, this medicine doesn't work, or this medicine, is evil or whatever because the withdrawal is so difficult. But the problem is they're not following the plan appropriately, right? They're not tapering down low enough. But even some people have trouble stopping the medicine at super low doses. It's very difficult, right? So this is where I might use some of these other medications like Lucemira or Clonidine, these medicines or gabapentin or whatever that don't work great for blocking opiate withdrawal, but they work some, And so what I might do is get a patient down to like 0.5 milligrams of buprenorphine every other day or something like that. And then once they're ready, like they've got a week of vacation, or they got like a long weekend plan, we'll stop the medicine. And maybe we'll then add these medicines to try to blunt the effect. Because I think at that point, these medicines seem to be more effective when they're not trying to, override such severe withdrawal. And I used Clonidine and Neurontin not too long ago in a patient, very effectively to have them stop buprenorphine. But we did it with a plan. We did it, and I've done that also with folks who are just on opiates and they don't want to go on buprenorphine. They don't really have necessarily an addictive history, but they have a high dependence history. And we've talked about the difference between addiction and dependence in the past. So for some folks who just have like some chronic pain issues, they became dependent on pills, but now they just have difficulty stopping, but they're not, in this abusive cycle. Sometimes I'll just use those medicines, taper down the opiate, stop the opiate, use those, blunt the effects of the withdrawal, and they're good, after a few days. So that's just a thought. Now, obviously, these medications have side effects and risks, and you should never take these medicines without talking to your doctor. So I'm not telling you how to taper off specifically. I'm just giving you ideas of what I've used with other patients that you can then discuss with your doctor, and if you're ready and when you're ready, etc. Okay, guys, hope that was helpful. Let me know if you have any questions. Shout out to my Mississippi State Bulldogs. All right, y'all go to church. Peace.